We should examine the temporomandibular joints themselves, of which there are clearly two, one on each side. These two joints operate in a symmetric fashion. That is, both joints must function in order for us to achieve proper jaw function. It can move laterally, indeed, that is, from side to side, which means that when you observe closely the joint here, it does not readily permit that motion until the jaw has opened up fully. That joint, which we commonly abbreviate as TMJ, is essentially a single term that stands for the fact that we have the temporal bone up here and we have the mandible down there, and so it becomes the temporomandibular joint. And there, down here, we have that joint, which is somewhat special because when the joint moves, it opens up. Now I'm going to try to see if I can do it here without ruining things for now. So it opens downward and forward whenever the joint is supposed to move. Between the temporal bone and the mandible, we have then a disc that should basically follow along outward and fill the hole that is left behind when the joint moves, so to speak. Or what should one say? Like the bones that, in fact, truly separate from one another. The disc itself can, in fact, form an overfold, so that the jaw joint on one side, for example, indeed no longer functions properly. There may also be cases where the muscles simply contract, causing the joint to sublux, i.e., it no longer sits quite correctly within the jaw joint. And of course there can be muscular asymmetry between the two sides, such that the jaw does not function properly. No matter which type it is, we simply call it an occlusal disorder. And an occlusal disorder is, in other words, a situation in which the jaw no longer functions correctly. It can also be that a person has a crooked or misaligned bite in many cases indeed. It may very well be the case that some people grind their teeth because they simply have too much pressure on only one side of their jaw. It may also hurt when you chew. And last but not least, it can also mean that, for instance, one of the jaw discs is constantly producing these audible clicking sounds whenever you open and close your mouth. And it does not have to be limited to the moment you eat. We have three muscles that act as the primary movers for the temporomandibular joint, the TMJ, and the two inner ones here, which actually also help pull the disc forward, called the lateral and medial pterygoid muscles, are, of course, among the muscles we treat when we address the primary muscle, which most people can probably remember, sits here inside or on the outer face, namely the masseter muscle. The masseter muscle is a rather special muscle indeed, because it helps to close the mouth as well. What should we say when we are not supposed to say anything at all? And that means that it is not only involved in crushing food, and when we chew, but also that it really keeps the mouth closed if there is nothing to say. Which means that it is a postural muscle, and keep in mind that postural muscles tend to enter what is called hypertonia. When muscles enter hypertonia, they spasm at rest, and that can contribute to, for instance, if they do this on one side, that we actually have a joint able to move on one side, but not on the other side. And thus you get asymmetry of the TMJ. Why does this muscle go into hypertonia? There can be many reasons for that as well. First and foremost, because it is a postural muscle, but also because it is one of the most emotional muscles we have in our body, and an emotional muscle. That is, it is also affected if you have some dysfunction around the emotional system and other factors in many cases. It could be that this is stress, it could be mental overload, or it could be problems that are indeed mainly controlled by our hypothalamus. So there could be many causes indeed. And why is this one so emotional exactly? It is thought to have something to do with the time when humans did not yet have language at all. That is, people in fact used markings, just as animals do, for many generations. Let us take a dog, for example, as if it were trying to tell a human to stay away from it, for instance, because it might be afraid, or that it is aggressive or does not want anyone to come near it. It shows its teeth by tensing its muscles, and we humans did so too in the past, when we did not have language. To signal to others that we do not want anyone at all to come near us, not even to stand close. Then we simply press together very tightly and fully tense our masseter muscles. That function remains, of course, as an emotional muscle, and therefore there are countless people who suffer from jaw tension, or perhaps temple headaches caused by prolonged overexertion. if someone has some emotional problem to deal with right now. The occlusion disorder is something we need to investigate, and it is, in fact, actually fairly straightforward. We have 5 tests, and one could say that if you have more positive than negative tests, you can be fairly sure that there is indeed an occlusion disorder. So let us go through them first here on the skeleton, before we try to show you it on a real, living patient. First, I would like to palpate and determine whether the joint actually opens, and we can see that the ear opening sits here right beside it. So what I do is I slip a small finger into the patient's ear canal and position my finger here forward. And I do that on both sides, and then I kindly request the patient to open their mouth. And when the patient opens his mouth, I should be able to clearly feel that what happens here is symmetrical with what happens on the other side. When the patient opens the mouth, I should clearly sense my 2 little fingers forward in the patient's ear canal, as if a small hole opens on each side at the same time. The very next thing is that I palpate under argus here, that is, right here below, and I actually palpate the masseter muscle, and again palpate the symmetry between the left and right masseters. I must be able to feel that the muscles are in the same state of tension, and they are working at the very same time today, please. The next step is that I keep a very careful watch to see whether the patient actually opens his mouth properly. So, I'm sitting here at the very end of the bench, looking from the tip of my nose down toward the jaw, and trying to get a sense of whether the jaw opens correctly, or if it's a little bent this way. They do this typical swing you see when they open the jaw, that the jaw doesn't move quite symmetrically during the opening. So there should be a certain symmetry, or balance, in the way a person opens the mouth, especially when opening it in a perfectly straight upward direction. In that situation, you will observe someone who opens it quite crookedly upward, clearly not in a straight line. The next step in the procedure is that I ask the patient to close the mouth, and then I must be able to follow, in terms of what is being described, the fissure that runs from the middle of the upper front teeth down to the middle of the lower front teeth. Thus they must stand directly opposite one another, and here one would typically observe that someone who has, for example braces, has had this pulled very crookedly, and it somehow ends up matching together more closely than before. It may be that the jaw is actually quite asymmetrical, so there should, in fact, be a small gap between the upper and lower jaws at the teeth, and they no longer simply sit directly opposite one another the way they once did. And there you could say that there is always quite a degree of gradation to it, so you don't just set up one thing, that is, the single sign indeed, you need to take all 5. The last part is that you ask the patient to open their mouth, and then they must now be able to completely flex their index and middle fingers, and you must be able to insert them into the mouth. Even when you place them in your mouth, there must be a clear space between them. In other words, you should be able to fit 2 fingers inside the mouth, and they must be kept in a position that avoids touching either the upper jaw or the lower jaw. So, to show what I mean, I'm opening my mouth now, and you can see just a gap between my upper and lower jaw today. Many people with these occlusion disorders cannot open their mouths properly, meaning they cannot even fit in 2 fingers. It is not enough to get them inside, because they must not sit clenched in the jaw. If they are to stay clenched, you would need to do it with 3. Then they may, so to speak, touch and sit in tension, truly. So that is the question really. If you can't do that, it's not enough on its own. You must remember to set it up properly with the other 5, so we have 5 after all as well. 1. Palpate the joint thoroughly. 2. Palpate the masseter muscle gently. 3. Check the symmetry of the jaw as it opens evenly. 4. Look closely at the line on the teeth. And 5. Is there room when the patient opens the mouth so that 2 slender fingers can fit inside the mouth, flexed, and there is no contact with either jaw on either side? If that is not the case, if there are 3, 4, and 5 positive signs, then we have an occlusal disturbance, which of course we must treat.